Well, what risk do pregnant women face? It's a question that seems to have no clear answer as doctors and nurses navigate what they know so far about the virus. As Q2's Andrea Lutz reports, hospitals like Billings Clinic now restrict visitors and only allow one support person in the labor room.
Well, I naturally had some questions about COVID-19 and pregnancy because I myself am in my second trimester and staying at home, working at home. But because there's so many questions out there and so many unknowns, I decided to talk to a doctor at the Billings Clinic to get some perspective.
Unfortunately, right now, we don't know a lot about COVID-19 and pregnancy.
And that's probably the most troubling part. OBGYN Amy Hopstad says there's just not enough data coming out of China about the virus so far.
What we do know with other respiratory infections, things like influenza and prior SARS outbreaks, pregnant women are more vulnerable and tend to get sicker. So we're taking extra precautions to keep our patients safe.
Pregnant women experience a decrease in their immune system, and that naturally makes them vulnerable.
Your immune system goes through a lot of changes in pregnancy, really to protect the developing fetus. And so your immune system kind of gets put on the back burner a little bit. That and there probably are some other physiological changes that happen in the lungs and things like that and make respiratory illnesses especially potentially more serious in pregnant people.
So because of that, Billings Clinic is taking precautions.
Now we have more visiting restrictions than we ever used to have in that, kiddos under 18 aren't allowed. You get one support person, and that person for now is allowed in the labor room and postpartum and can stay here with you.
So for now, safety, they say, is the best policy until health professionals know more.
Honestly, all of us are a little bit uneasy with it just because we're hearing other case reports from other cities that are harder hit. And it's hard for everyone. So just to be careful. The fortunate thing is most pregnant women are young and healthy, and for the most part should do fine.
So while there are some restrictions at hospitals here, Hopstad says she doesn't anticipate Montana doing what other states have done, like New York, where no support person is allowed in the labor and delivery room. In Billings, Andrea Lutz, MTN News.
All right, thanks, Andrea, and stay safe.